Hi, my name's Maddie. I'm going to be your nurse practitioner student today. I'm just going to do a physical exam, if that's okay with you.
Sounds great.
So we're going to kind of go head to toe. First thing I'm going to look at is your scalp, just assessing for symmetry, any signs of trauma. I'm just going to feel your scalp really quick. Good. I'm going to feel for your pulses right here. I'm going to do a few things to assess your cranial nerves. Could you raise your eyebrows up for me? Good. And close your eyes super tight. Could you make a frowny face? Good. And give me a big smile. Show me your teeth. And puff out your cheeks for me. Great. I'm going to feel your jaw here. Could you open your mouth a couple times? Good. And now clench your teeth for me. Great. I'm going to have you close your eyes and just tell me when you feel me touching you with this cotton swab.
No. No. No.
Great. You can open your eyes. I'm just looking at your eyes, looking at your eyelashes, assessing for symmetry. Everything looks good. I'm going to shine a light in your eye. So I would dim the lights right now. I'm going to have you look at a spot behind me. I'm just going to shine the light in your eye a couple times. Good. Other side. Great. Okay, now I'm going to shine the light in your eye for a little bit longer. Just keep looking at the wall behind me. Okay. Just going to hold your eye open here. Good. Looking for the red light reflex. I'm going to get a little closer. Looking medial and lateral. Good job. I'm going to look on the other side. Keep looking at the wall behind me. Looking for the red light reflex. Getting a little closer. Looking medial and lateral. Good job. Okay. Next thing I'm going to have you do is just follow my finger, okay? So keep your head still. Just going to have you look this way. Over. And then all the way in towards your nose. Good job. All right. Next thing I'm going to look at is your ears. Just going to look at the external structure. Good. Everything looks good. I'm going to look in your ears. So pulling the pin out up and back. TM looks nice and pearly. Great. I'm going to do a quick whisper test, okay, just to assess your hearing. So I just want you to repeat the words back to me, okay?
Yep. Red, blue, yellow. Cat, dog, mouse, mouse.
Great. All right, next thing I'm going to look at is your nose, okay? First thing I'm going to do is just plug each side. I just want you to take a deep breath in. Good. All right, I'm going to look at the internal structures of your nose. It's a little tickly, I apologize. Everything looks pink and healthy. The other side. Everything looks good. I'm going to look in your mouth. Just open up for me. Good. Looking at your teeth, looking at your gums. Alright, lift your tongue up for me. Good. Stick your tongue out. Say ah. That's your gag reflex. Looks good. Okay, next thing I'm going to look at is your neck. So just looking at your trachea, everything looks symmetrical. I'm going to feel for your lymph nodes here, okay? any nodules. Everything feels good. Lift your shoulders up for me. Great. Okay, next thing I'm gonna have you do is take a sip of water and just hold it in your mouth. Good. Looking at your trachea, everything looks symmetrical. I'm just gonna take a feel here. Okay. What I want you to do is tilt your chin forward and tilt your head towards me. Now swallow your water. Great. Take another sip. I'm gonna feel again. Tilt your head down and away from me and take another swallow. All right, perfect. Your thyroid feels great. All right, next thing I'm gonna have you do is just pull your gown down for me. I'm just gonna look at your chest, assessing for symmetry, looking at your AP diameter. Everything looks good. No respiratory retractions. Work of breathing looks good. Next thing I'm gonna do is just palpate your chest, okay? I'm gonna do the same thing on the back, okay? Great. Okay, next thing I'm gonna do is take a listen to your breathing, okay? So each time I move my stethoscope, I just want you to take a breath in and out. All right? Great. I'm gonna listen on the back. Same thing. Great. Okay. Next thing I'm gonna do is just look for your carotid pulses. I don't see any pulsation, so I'm just gonna take a feel here. Good. And I'm gonna take a listen with my stethoscope. I'm gonna listen with the other side as well. Looking at your chest, I don't see any pulsations or heaves, so I'm just gonna listen to your heart sounds, okay? You can just breathe normal this time. I'm gonna listen with the other side as well. I'd like to listen one more time with you laying down, if you wouldn't mind. Great. I'm going to do the exact same thing. Okay, next thing I'm gonna do is just lift your gun up and take a look at your belly. Okay. Alright, I'm just looking for symmetry, looking for any signs of scars, looking for any bruising or discoloration. Next thing I'm gonna do is just take a quick listen to your belly. And I'm going to percuss your belly here.
Okay.
I'm going to percuss your liver. Good. I'm going to feel for your liver, so I want you to take a deep breath in and then all the way out. Good. I'm going to feel around your belly. Just want you to tell me if you feel any pain, discomfort, anything like that. Okay, I'm gonna press a little deeper.
Feels okay.
No pain. Okay, that's great. Put this down. Okay, next I'm gonna look at is your hands. Good, just feeling for warmth, looking at skin color. Everything looks good. Just checking for cap refill here. I'm gonna feel for your radial pulses. Feels good. Assessing your brachial pulses here. Feel no signs of swelling or edema. Nice strong pulses. I'm gonna do the same thing here on your legs. Just assessing for any signs of swelling or edema. Feels nice and warm in both sides. I'm gonna assess your pedal pulses here. Posterior tibial pulses. I'm gonna assess your popliteals. I'm just going to feel for your femoral pulses, okay? Great. That's it for today.